This is an evidence-based nursing leadership capstone project for the prevention of diabetic foot ulcers through patient education by Elizabeth Newman RN. We'll review our introduction, evidence-based research, stakeholders and performance improvement metrics, roadblocks and challenges, patient-centered and family-centered care, patient education and interventions, cost of implementation of the project, safety and quality improvement, cultural, ethical, and legal considerations, ending with our conclusion and our reference slide. Does providing patient education improve the healing and prevention of diabetic foot ulcers versus not providing education? This evidence-based nursing leadership capstone project is a program for the prevention of diabetic foot ulcers, DFUs, in patients in the outpatient clinic setting through patient education. Zielinski et al. 2018 report preventative measures should be taken early in the DFU process to protect the diabetic foot from breakdown, to prevent ulceration, to avoid lower limb amputations. Manami et al. 2015 reports several studies, including some randomized controlled trials, have shown that patient education is capable of reducing the risk for diabetic foot ulcers. I use the FOCUS-PDCA Performance Improvement Model with the Johns Hopkins Nursing Evidence-Based Practice Implementation Model, Masters 2020, leading to the development of my PICOT question: does providing patient education improve the healing and prevention of diabetic foot ulcers versus not providing education? Statistics show the dire need for the prevention of DFUs. The 5-year survival following presentation with a new DFU is of the order of only 50 to 60%, and hence worse than that of many common cancers, according to Jeffcoats et al. 2018. Additionally, they report data derived from a Veterans Health Administration population reported that 1, 2, and 5-year survival was only 81, 69, and 29%, respectively, and the association between mortality and DFU was stronger than that of any macrovascular disease. Further research significantly noted that clinically meaningful improvements in diabetic foot health seem to be associated with two combinations of intervention functions. Number one, diabetic foot care education and foot care skills training delivered in combination with enablement, which is providing foot care equipment and prompts like daily diaries. Or number two, diabetic foot care education and foot care skills training delivered in combination with persuasion, which is information to elicit an emotional response around what is good or bad for foot care behavior. Patton et al. 2021. Stakeholders are those affected by diabetic foot wounds and those who would benefit from increased knowledge on diabetic foot care and includes people with diabetes, the families and caregivers of people with diabetes, those at risk for diabetes, nurses who care for diabetic patients in various settings, nurse educators, and healthcare providers who care for diabetic patients. This would be the diabetes team. Evaluation metrics for measurement of the effects of improved patient education for prevention of diabetic foot wounds would include tracking foot care knowledge with surveys of patients, families, and caregivers before and after education. In the clinic setting, the number of patients with recurrent foot wounds could be monitored with the number of foot wounds noted before and after foot care and foot wound prevention patient education, and to conduct surveys of nurses and healthcare providers on the effects of the suggested education on patient knowledge of foot care and other recommended needs. The goal would be an increase of at least 50% within 3 months of implementation of improved patient education on diabetic foot care. Roadblocks and challenges. The goal of this project is to improve patient knowledge and implementation of methods for the prevention of diabetic foot ulcers through patient education in the outpatient setting. Stakeholder buy-in will be a challenge for this program. To overcome this challenge and improve stakeholder engagement requires teamwork, including the sharing of data on the need for improvement of diabetic foot care education, methods for improvement, educational materials, methods for evaluation, and methods for maintaining changes. Overcoming roadblocks would include using the ADA's Taking Care of Your Feet pamphlet, 2018. It's a one-page sheet that covers key points of diabetic foot care. By having this handout available while providing demonstration, explanation, and teach-back education, the patient's knowledge and understanding of good diabetic foot care will improve. Additionally, providing statistics and education on the risks for diabetics who do not practice good foot care, including foot ulcers that can lead to toe, foot, and leg amputations and increased risk of death, may help overcome roadblocks. Patient-centered and family-centered care. Diabetes management requires individualized and comprehensive treatment targets for the prevention of complications, e.g. appropriately controlled blood glucose, blood pressure and lipid profile, and weight management, smoking cessation, healthy diet, and increased physical activities. There should also be a strong focus on patient self-management and empowerment. Zielinski et al., 2018. As discussed on the prior slide, stakeholder buy-in is important for providing patient-centered care for the diabetic patient. By providing statistics and complications and education on the complications and consequences of not performing good foot care versus the benefits of performing improved foot care in diabetics, stakeholders will be motivated to learn about and implement good diabetic foot care techniques. After all, according to Jeff Cote et al., the 5-year survival following presentation with a new DFU is on the order of only 50 to 60%, and hence worse than that of many common cancers. Patient education. Only 12% of U.S. adults are considered to have proficient health literacy, Masters 2020. Patient education requires knowledge of a patient and family's health literacy, along with their preferred learning style. It is important to be aware of cultural differences when assessing for educational needs and providing patient, family, and education to caregivers. The appropriate reading level for education for most patients, family members, and caregivers is 4th grade, Masters 2020. Patients, families, and caregivers should be taught using multiple educational methods for best retention, to include explanation, demonstration, and teach-back methods. Patient education methods include explanations such as using the ADA's Taking Care of Your Feet pamphlet, 2018, for reference, which is written at a Flesch-Kincaid grade level of 3.8, which is a 4th grade reading level. Demonstrations using the use of a mirror to see the bottom of the foot and in between the toes if needed, along with teach-back methods in which the patient, family, caregiver repeats back and shows how to do a proper foot check, including using a mirror if needed to look for calluses, wounds, dry skin, cracks in the skin, drainage from the foot, which would indicate a wound, blisters, or redness. How to wash and dry carefully, especially between the toes of the foot. Proper moisturization of the skin of the foot, except between the toes. And how to check their shoes with their hand before donning to prevent getting stuck with something that may injure the foot or cause a wound, and more. Costs of implementation include that handouts can be printed from the ADA website or ordered from the ADA, resulting in minimal cost. There may be a slight increase in cost as far as the time required by the nurse for complete diabetic foot care education, both primarily and at follow-up. It has been reported that up to 1/3 of diabetes expenditure is on lower limb-related problems in the U.S. Jeff Cote et al., 2018. The cost of implementation of my plan would be greatly outweighed by the cost of diabetic foot wounds care. Safety and quality improvement. Diabetic foot ulcers are costly both in economic and health means. In order to decrease these costs, diabetic patients must learn good techniques to prevent foot ulcers that can lead to infection, hospitalization, and possible amputation. This project provides evidence-based patient education to improve patient outcomes in the area of diabetic foot care with ulcer and amputation prevention. According to Manami et al., several studies, including some randomized controlled trials, have shown that patient education is capable of reducing the risk for diabetic foot ulcers. Patton et al. 2021 additionally report that research shows to increase impact on foot health outcomes intervention, designers should shift emphasis towards empowering and building patient confidence to ensure sound decision-making around taking preventative action or seeking professional help when warning signs of ulceration are discovered. Culturally, it is important that interventions and education not go against a patient's cultural or religious beliefs. Patient education must be provided in a culturally sensitive way to improve patient understanding and acceptance. Ethically, it is important that interventions and education not go against a patient's ethical beliefs, supports their autonomy, uses beneficence, acts with non-maleficence, and follows the principles of justice, Masters 2020. Legally, it is important that interventions and education follow within the nurse's scope of practice and follows their state's Nurse Practice Act. Through education, thorough education that is well documented helps to protect a nurse from malpractice and negligence allegations. Additionally, when doing surveys and tallying scores, it's important to keep patient confidentiality in mind. In conclusion, this evidence-based nursing leadership capstone project is a program to prevent the development and recurrence of diabetic foot ulcers using patient education in the outpatient clinic setting. I use the focused PDCA performance improvement model with the Johns Hopkins Nursing Evidence-Based Practice Implementation Model, Masters 2020, to describe implementation of my program. This project required my prior nursing education and knowledge to create, including the nursing process to assess, design, plan, implementation, and evaluate for expected outcomes in the areas of patient education and decrease in development of diabetic foot ulcers, including overcoming cultural, legal, ethical, safety challenges, and roadblocks to implementation. Thank you for your time. Here's my references.